I want to talk to you about breast cancer treatment, but first, can you explain to me the different stages? What does that mean?
Okay, so the stage has a lot to do with the different characteristics of the breast cancer. So the size of the breast cancer, if there's any lymph node involvement. And then once we have a stage of the breast cancer, it helps us determine what the treatment plans are going to be, the surgical plans, the medication plans, chemotherapy. It also then gives us an idea of what your prognosis is or risk of recurrence based on the stage of cancer that you have. So early stage breast cancer is typically stage 1 or stage 2, where they have a smaller tumor, may have 1 or 2 lymph node involvement. Also, it does depend on the characteristics of the tumor. So a woman having a hormone positive tumor tends to have a lower stage. When you start talking about larger tumors that ulcerate out of the breast or multiple lymph node enlargements, then you start talking about locally advanced or stage 3. And then if a tumor has gotten outside of the breast tissue and has traveled to a distant location, that's considered metastatic breast cancer.
Okay. And when you're talking about treatment, who all decides what the treatment will be?
So it really is a multidisciplinary decision, because the breast surgeon will decide what type of surgery is appropriate. As well, sometimes the surgery is then followed by chemotherapy or a pill. There are times where chemotherapy will come first and then surgery.
What could some of the treatment options be?
So typically the first decision is going to be the surgical decision, and that will be either a lumpectomy where they take off just a portion of the breast, or a mastectomy where they take off the entire breast, or a bilateral mastectomy where they take off both breasts. So typically the surgery is the first decision that's made. And then based on that, we decide if chemotherapy is necessary, or if just a pill is necessary, or a combination of both. As well as then it will make a decision on if they need radiation as well.
And are all those things decided in the beginning, or do you have the surgery and then you decide the next step?
A lot of times it's sequential. So you'll do the surgery first, then you'll meet with the medical oncologist, and then the radiation oncologist, or in some sort of order like that. So it's not all decided on day 1, but typically what's decided is surgery going to be first, or if chemotherapy is necessary, is that going to be first? That typically will be the first decision. If we know surgery comes first, we kind of get through surgery and then we move on to the next steps.
Okay. And if someone has a mastectomy, I think people think then the cancer is gone. So why do you have chemo if you had a mastectomy?
Yeah, that is a question that very many women ask and don't understand, when we're sometimes like, well, you'll still need chemotherapy even if you have a mastectomy. So a mastectomy is getting rid of the breast tissue and the cancer that's in the breast, but the chemotherapy is getting throughout the entire body. So if a cell got loose that we physically cannot see, radiographically can't see, the chemotherapy will get at the entire body to kill any cancer cells from coming back outside of the breast tissue.
Okay. Can you talk about side effects? I remember what it used to be. Is it still you throw up all the time?
We have come a long way with supportive medications for chemotherapy. And so women, for the most part, like I was saying before, is that they should live a pretty normal life while getting chemotherapy. You will be tired. You will have nausea, but if a woman is vomiting, we really need to assess what the situation is, because we have really good supportive medications for pretty much any side effect that a woman has.
And what about things like neuropathy? These more serious, how often does that happen, and what is it that's happening?
Yes, so the neuropathy is a common side effect of most of the chemotherapy agents that we give. And again, now we have some new supportive medications. A lot of women will do something called cryotherapy, where they put ice on their hands, things through Amazon that you can get, ice gloves that helps with the neuropathy. The most important thing, I think, through the entire thing is the education. And in our office and in most oncology offices, we have a chemo educator that will meet with the patient for an hour before they start chemotherapy, just to go over all the side effects, things to expect, what kind of help that they have. And in our office and in most offices, we have a good support system so they can call us with any questions.
Yeah. Can you talk also, I feel like it's changed a lot, where before, when you got breast cancer, you kind of thought you were going to die. And now that doesn't seem to be the case at all. Is that right?
That is right.
Yeah.
Most women with breast cancer have a very good prognosis, a very good survival. Most breast cancers are curable. And a lot of it really comes down to getting screened. So getting your mammogram, getting it caught early. We have updated mammogram machines. Some women require breast MRIs. So we're able to pick up breast cancers at much earlier stages. And so they are very curable. Even women who have advanced disease, we have a lot of new medications that we sometimes call it a chronic illness. So metastatic breast cancer can be a chronic illness where patients live for many, many years with breast cancer.
Once you're diagnosed with breast cancer, for the rest of your life, do you have to worry about it?
So it does depend on the type of breast cancer that you have to depend on what the recurrence rate is, whether the risk of recurrence is in the first couple years or risk of recurrence over 5 to 10 years. But in general, once women get through the initial stage and the initial treatment of their breast cancer, a lot of times it just becomes something that is in the back of their mind, but not something that they think about all the time.
Great. Dr. Levenbach, thank you so much.
You're so welcome.
Thank you.